Lesson 3, Recovery, Returning to School and Play.
In Lesson 3, you will learn your responsibilities related to concussion recovery. You will also hear about the return to non-sports activity process, such as returning to school, which is the first thing an athlete needs to complete. And you will see the steps you need to take to help an athlete safely return to school and sports activities after a concussion. While most athletes with a concussion feel better within a couple of weeks, for some, concussion symptoms may last for several months. Factors that can delay concussion recovery include having severe symptoms right after the injury, history of migraine headaches, and a history of anxiety or depression. Athletes with learning disorders or ADHD prior to the concussion may have an even more difficult time returning to school after the injury. Athletes who experience symptoms for more than 4 to 6 weeks need to be seen by a healthcare provider who is an expert in the management of concussion. After concussion, some athletes are eager to get back to sports right away. So you may be wondering, what is the best way to help an athlete have a good recovery? The good news is that the majority of athletes will have a good recovery. You can help by keeping positive and being supportive during their recovery. Remember, an athlete should complete a gradual step-by-step process to return to regular non-sports activity. This includes getting back to school before starting a return to sports protocol. An athlete's healthcare provider should first provide a return to non-sports activity plan based on an athlete's symptoms. For most athletes, this plan will include resting after the injury for 2 to 3 days. This is when symptoms are usually most severe. Rest does not mean making the athlete sleep all day in a dark room. Instead, rest may involve taking it easy at home at first and taking a break from school for a day or two. As a student starts to feel better, and within a few days after the injury, an athlete can start light activities, such as taking short walks. Athletes should also be back at school. Only rarely should a student miss more than 2 or 3 full days of school after the injury. An athlete may feel frustrated, sad, angry, or lonely while recovering from a concussion. Talk with them about it and allow an athlete recovering from a concussion to stay in touch with their teammates, such as cheering on their team at practices and competitions. As an athlete returns to school after a concussion, changes in the classroom may be needed to help limit their symptoms. Examples include lessening the student's class load a few days right after the injury, allowing for break times or naps during the day, and extending time to complete assignments and to take tests. So why is it important to support athletes as they return to school? Researchers estimate that as many as 30% of athletes have trouble in school after a concussion. This may include athletes having more difficulties than usual doing homework or getting lower grades than before on tests. Giving athletes extra support during their recovery can help them get back on track. You can get more tips on the return to school process, such as using a team-based approach among school and healthcare providers, by clicking on the Resource Center button. When symptoms are mild and nearly gone, an athlete can return to most of their regular non-sports activities. A student is considered recovered from a concussion when they are able to do all of their regular activities without experiencing any concussion symptoms. When the return to regular non-sports activities is complete, an athlete can get the green light from their healthcare provider to start the return to sports process. So, what is your role in helping an athlete return to sports? If you do not have an athletic trainer to help, your role is to work closely with the athlete's parents and healthcare provider to ensure the athlete returns to sports safely. Be sure to ask for written instructions from the athlete's healthcare provider to help you with this process. As you follow these instructions, you will be tasked with watching out for concussion signs and taking note of symptoms the athlete may report. The return to sports process includes 6 steps. First is that the athlete is back to regular non-sports activities. Second, they can start light aerobic exercise. Third, sport-specific exercises can begin. Fourth, the athlete can take part in non-contact training drills. Fifth, they can participate in practice and full contact activity if relevant. Sixth, the athlete is cleared for competition. There should be at least 24 hours, or longer, between each of these steps. If any symptoms appear or worsen during the process, the athlete should stop that activity. After a day of rest in which the athlete does not experience symptoms, they should go back to the previous step. So, for example, if the athlete experiences a headache during step 4, they should stop this activity. After a day of rest in which they no longer experience headache or other symptoms, they can then start back at step 3. Now let's go over each of the steps in the return to sports process in more detail. We've gone over step 1 and the return to regular non-sports activity, so let's start with step 2, which is light aerobic exercise. During step 2, the goal is to increase the athlete's heart rate. To do this, the athlete can walk on a treadmill or use a stationary cycle at a slow to medium pace. They should not do any resistance training at this time. Step 3 focuses on sports-specific exercises. The goal in this step is to add more body movements. Exercise may include running or skating drills. However, these drills should not include any risk for contact or collisions. Athletes in step 4 can begin non-contact training drills. The goal is to increase exercise, coordination, and thinking. Activities in step 4 may include harder training drills, such as passing drills. The athlete may now start progressive resistance training. Step 5 only applies to contact sports. The athlete is able to participate in full contact practice. The goal is to help the athlete restore confidence and to allow coaching staff to assess functional skills. Following medical clearance, this step includes participating in normal training activities. The end of the return to sports process comes in step 6. At this step, an athlete should now be a full participant in practices and games without support.
Please click the Continue button to proceed, located at the bottom right corner indicated by the green arrow.